Hi, today we will discuss the causes of anxiety. In the previous lecture, we discussed about the anxiety, what is the anxiety attack, and the symptoms of anxiety and the symptoms of anxiety attack. Then now we will discuss what causes anxiety. Researchers are not sure of the exact cause of anxiety, but it's likely a combination of factors play a role. These include genetic and environmental factors as well as brain chemistry. In addition, researchers believe that the areas of the brain responsible for controlling fear may be impacted. Current research of anxiety is taking a deeper look at the parts of brain that are involved with anxiety. Are these tests that diagnose anxiety? Are there any tests? As stress does not measure by any test, it is unmeasurable. It cannot be measured. But for anxiety, a single test cannot diagnose anxiety. Instead, an anxiety diagnosis requires a lengthy process of physical examinations, mental health evaluations, psychological questionnaires. The questionnaires are the very good solutions to examine to evaluate the anxiety, stress, or depression levels. Some doctors and healthcare providers may conduct a physical examination, including blood or urine tests, to rule out underlying medical conditions that could contribute to symptoms you are experiencing. Several anxiety tests and scales are also used to help your doctor assess the level of anxiety you are experiencing. But the basic basic test deals the proper questionnaires related to that disease. What are the treatments for the anxiety? Once you have been diagnosed with anxiety, you can explore treatment options with your doctor. For some people, medical treatment is not necessary. Lifestyle changes may be enough to cope with the symptoms. In moderate or severe cases, however, treatment can help you overcome the symptoms and lead a more manageable day to day life. Treatment for anxiety falls into two categories: psychotherapy and medications. Meeting with a therapist or psychologist can help you learn tools to use and strategies to cope with anxiety when it occurs. The Helpline Find Care tool can provide options in your area if you need help finding a mental health specialist. Medications typically used to treat anxiety include antidepressants and sedatives. They work to balance brain chemistry, prevent episodes of anxiety, and ward off the most severe symptoms of the disorder. What natural remedies are used for anxiety? Lifestyle changes. Lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with every day. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating unhealthy ones. All these include getting enough sleep, meditating, staying active, and exercising. Exercising your muscles, body exercises will keep your mood boost up and happy. Eating a healthy diet at proper timings and proper diet. Staying active and working out. Don't get be lazy, just stay active. Avoiding alcohol or drugs, avoiding caffeine, quitting smoking cigarettes. If these lifestyle changes seem like a positive way to help you eliminate some anxiety, read about how each one works in this link. Then we will discuss the anxiety and depression, the difference between the anxiety and depression. If you have an anxiety disorder, you may also be depressed. While anxiety and depression can occur separately, it isn't unusual for these two mental health disorders to happen together. Anxiety can be a symptom of clinical or major depression. Likewise, worsening symptoms of depression can be triggered by an anxiety disorder. Symptoms of both conditions can be managed with many of the same treatments, like psychotherapy, counseling with the therapist or the best friend or the doctor, medications for your symptoms like headaches and panic attacks, and sleep and lifestyle changes. How to help children with anxiety? Anxiety in children is natural and common. In fact, 1 in 8 children will experience anxiety. As children grow up and learn from their parents, friends, and caretakers, they typically develop the skills to calm themselves and cope with feelings of anxiety. But anxiety in children can also become chronic and persistent, developing into an anxiety disorder. Uncontrolled anxiety may begin to interfere with daily activities. Children may avoid interacting with their peers or family members. Some symptoms include jitteriness, irritability, sleeplessness, feelings of fear, shame, and feelings of isolation.